navigating this. Okay, we're going to start. Okay, everybody, we're going to go ahead and get started with our today's webinar featuring Julie Moon, our local physical therapist. And actually, she does both land-based therapy and aqua therapy, and that's what this topic is about today for you folks. So can somebody send a chat or an email, chat or text me 234-3117. You can hear my voice, because we're still learning this system here. I can hear. Oh, great. All right. So we got this. So anyway, Julie Moon is here today, and we'll be talking about aqua therapy. And so, where'd my thing go? Oh, where'd it go? There you go. I'm still new at this. Anyway, this is Julie Moon. She's down here on Ward Avenue, across Sports Authority. I'll let Julie introduce herself because I can go a whole list of things that she's done. She's on YouTube channel. She's on Facebook. She has a website. So Julie, why don't you go ahead and introduce yourself, and we'll get right to the webinar. If you have any questions, you can put it in the chat box. I'm still learning how to use the chat box, but these are done every month, our webinars. So thank you for our HPGS members and our Public Health members as well. We will put this on our YouTube channel in probably next week or so. If you go to our YouTube channel, Hawaii Pacific Gerontological Society, you can see all our past webinars and with our speakers and our audio there. So thank you very much. And then Julie, why don't you go ahead?
Okay. Thanks, Percy, for inviting me to come and talk to you all today about healthy aging with water therapy. So I've been practicing aquatic therapy since 1998. It's a real passion of mine, and so I'm really excited to be able to share with you what I know today. So here at Moon Physical Therapy, we do your traditional land-based PT. We also specialize in aquatic therapy. We have 2 water units. We have an endless pool, which I'm sure you've seen the commercials. It has the current that you can swim against or exercise against. Percy goes in that one a lot. And then we have our new HydroWorks 300 Sport, which is a state-of-the-art underwater treadmill. So we're the only one in the state that has it. We've had it for almost going on a year. Patients love it, and I have some video later on that I'll be showing you guys about it. So just a quick overview of what I'm going to be talking to you today about. I'll go over what is aquatic therapy and a lot of the misconceptions that I've heard over the years. Then I'm going to talk about why water is so special when it comes to rehab, and then we'll go into the benefits of aquatic therapy for seniors. So the first thing, we'll just go into what is aquatic therapy. I just pulled a definition from the computer for Wikipedia, and it is aquatic therapy refers to treatments and exercises performed in water for relaxation, fitness, and physical rehabilitation. So almost everyone, regardless of age, can benefit from exercising in the water. Even if you don't know how to swim, just being in the water has inherent effects, from improvements in circulation to reducing joint pain. The rewards of exercising in the water are numerous. And I frequently come across patients, physicians, and insurance companies that think aquatic therapy and physical therapy are 2 completely separate forms of treatment. But actually, aquatic therapy is physical therapy. It's just performed in an aquatic environment. The modality that we use for treatment is water. So some people think that aquatic therapy is whirlpool therapy. So it's not whirlpool therapy, actually. Whirlpool therapy is when a patient is sitting fully in a whirlpool bath. You'll see it a lot in hospitals, or has a limb soaking in it, for a lot of times for the reduction of muscle spasm, or if sterile, for wound care. And aquatic therapy, on the other hand, is when the patient is actively engaged with the therapist when they're doing their water exercises. Water therapy is also not water aerobics, because of water aerobics, they're actually, it's delivered in a group setting, and it can be instructed by anyone other than a licensed physical therapist. The water aerobics is pretty much designed to maintain or improve your general conditioning. It does not require a physician's referral, and it's fee for service. Aquatic therapy, on the other hand, it's medically based, and that's where a physical therapist designs a treatment plan specifically for that patient's condition or injury. The patient works one-on-one with the physical therapist. It requires a physician's referral, and it's reimbursed through most medical insurers. So I've been treating a lot of patients in the water for a long time, and I've really seen the benefits from weight loss, increased strength, balance. It speeds healing after surgery. And I truly believe that this is the ideal medium, not yet, for when people are exercising, especially the aging. And the reason why I think that this is a true ideal medium for exercise is because it has 4 different physical properties. So the water has buoyancy, viscosity, hydrostatic pressure, and temperature. So buoyancy is defined as the upward thrust in the opposite direction to the force of gravity. So it reduces the effects of gravity by easing the amount of shock transmitted to your bones and ligaments. Good. So the more deeply immersed in the water you are, the less you weigh. When you are in hip height water, you weigh 50% of what you weigh on land. And then your weight is further reduced when you're in chest to neck deep water, and that's reduced by about 75 to 90%. So for example, if you have a patient that's 200 pounds, when they're in the water up to their neck, they only weigh about 20 pounds. So you can imagine this really helps to reduce your pain and your stress on your body. The second property of water is viscosity. So viscosity is defined as a measure of a fluid's resistance to flow. So liquids of high viscosity flow slowly, such as syrup. Water is 790 times more viscous, and it provides 12 times the resistance than air when you're exercising. So the higher viscosity actually makes muscles work harder compared to the same exercises that you're doing on land without stressing your joints or increasing your pain. Viscosity, it also creates an equal amount of resistance in all planes of motion so that all of your muscle groups get a balanced workout. So for example, if you wanted to strengthen your exercises of the knee, you would basically, on land, you would basically use a knee extension machine, or if you, for the front of the knee, or to exercise the back of the knee, you'd have to use a hamstring curl machine. But in the water, because of the greater viscosity, you can actually work both of the muscle groups at the same time with the same amount of resistance using one single exercise. So this creates a better balance between all the muscle groups, and it helps strengthen the weak muscles faster without increasing pain. So the third property of water is hydrostatic pressure. So that's produced by the weight of the fluid that surrounds your body. So the figure there, it shows all the immersed portions of his body underwater. And water is actually 1,000 times more denser than air. And when you are in the water, it's constantly adjusting the shape, accommodating your movements, compressing your skin, your muscles, and your joints. Hydrostatic pressure has been shown to increase blood flow to resting muscles by 100 to 225% when the water is up to your neck. And this can actually increase blood flow. It can help muscle performance and increase healing. The hydrostatic pressure causes the heart and lungs to work harder because the chest cavity is under direct pressure, and it also reduces swelling. So if you have a lot of swelling in your extremities, it helps that. It's actually the same effect as wrapping 17 ACE bandages around your entire body. Okay, and then the fourth physical property of the water that really helps is temperature. So the water temperature used for aquatic therapy typically runs at about 90 to 94 degrees. If you're in a heated pool outdoors, they run their temperatures at about 86 to 88. And the thermal properties of the water, it actually allows you to feel comfortable and exercise as soon as you get in. So you don't need that long warm-up period that you would typically have to do on land in order to prevent injury. It also increases your blood circulation, it promotes healing, reduces muscle tightness and spasms. It also decreases your overall pain, and it reduces soreness after you work out. And then the last thing, it's also relaxing physically and mentally. Okay, so there's two major factors that occur as we age. The first one is flexibility. So, you like that picture? No. So why is flexibility so important? Well, we need flexibility to perform everyday activities. Things like getting out of bed, picking something up from the floor, walking, we need that flexibility. And flexibility tends to deteriorate with age, oftentimes because we lead a more sedentary lifestyle. Without that adequate flexibility, daily activities become more difficult to perform. Losing flexibility, it's also a huge risk factor when it comes to falling. So if you guys notice that my model right there, he's hamming in front of the camera, that's actually my dad, Ronald Moon. So he's been actually doing water therapy since he fractured his L3 vertebra back in 2011. His neurologist told him that he could never do land-based therapy or land-based exercises because it'll put too much stress on his back because he has severe degeneration. So luckily his daughter has a pool, so he comes in and he exercises there. When you're exercising in the water, you're able to practice your balance a lot better than if you were on land. A lot of my patients that when I treat them for balance issues, they have difficulty progressing a lot of times because they have that fear of falling. But in the water, because you have the support of the water and the weightlessness, that fear of falling is essentially eliminated. And when that's eliminated, they can work harder and progress further, and then their balance actually becomes better. It transitions over to their functional activities on land. So the second major factor that happens as we age is we lose muscle strength. Next. So, but you don't have to worry, because when you hit, even if you're like 90 years old, there's research studies that show that, like this guy, we're still able to increase muscle strength. So we need muscle strength in order to do simple activities like stepping up or getting up from a chair. And if you lose that muscle strength, you're unable to do purposeful movements or activities of daily living. So both flexibility and muscle strength, they're super important as we all get older. So the next slide is actually a video. Okay.
Hobbies around. Hobbies someone else. Oh, like a little break.
Nice big step.
How was that? How? Monday?
But after kind of,
It helps.
yeah, so far.
What does it need? Like,
Longer.
Actually able to
We had to go in.
Patty, that looks
actually
great.
able to exercise walking without that compression of her joints. So as she's walking, you can see that she has
But hurting that bad. Hopefully it didn't.
just worth it, see?
oh,
Okay, let's go now.
okay. I don't know where I was. Okay. So as she's walking, okay. So as
How did that go?
can you guys hear?
Okay. So how much you have is one?
Yeah, just one.
Okay, so I hope you guys can hear me. Oh no. Okay, so you saw Patty, so she has severe knee pain. So as she's walking in the water, she's actually able to lengthen her stride length, mimicking how you're typically able to walk on land. She's not complaining about any pain when she's in there. The buoyancy of the water actually allows her to walk for longer periods. And although it might look easy to walk in water, it's not so easy. It's because the water is trying to push you in different directions at all times. So you're really working hard to get strength in your abdominal and your back muscles. So that promotes good posture. On the treadmill, on an underwater treadmill, it also helps because it allows you to float. So it, again, mimics your natural gait pattern on land. She can take bigger steps, which a lot of times is hard for older people. A lot of times they're shuffling. She's also able to walk independently in the water, where on land she needs a cane. In the water, she's able to practice her reciprocal arm swing, which a lot of times when we age, we lose that because of the fear of falling, losing balance. So it's really great for her. And then if we play it, she's going to actually turn and walk backwards.
Go backwards? Yeah, we'll turn around.
More later.
Said MRI thinks if it's still bad.
There you go, good. That's okay, you can hang on. Yeah?
Saturday, all day, Saturday.
Okay, so she went from forward to backward, and forward is good, but backward is even better because it actually forces you up into a more upright posture. So you see a lot of elderly patients. I'm sure you see people that they're bending forward a lot of times using their walkers, but as you're walking backwards, it puts you in a more upright posture. So you're really working your lumbar extensors, your core muscles, and that improves your overall stability and strength. A lot of times some would say, oh, we can go to the next one. Or before that. No, video. There's two videos.
Oh.
That one.
This one?
Watch the video. Yeah.
Good, you're doing great. Do you want to try side to side? Side to side, facing me. Yep. Good. Nice and tall. Big step. Good. We'll scoot over a little bit. Yep.
Okay, so Patty there went from forward to sideways, sidestepping. So a lot of people will ask me, well, why not just get like an anti-gravity treadmill? I think there's some clinics that have that because it does take the weight off of you while you're running or walking, but you're dealing with the cumbersome harness. And in the water is really key because you can go from a quick forward right into a sidestepping. She can also do a grapevine or a crossover, go into backward walking, all, and very quickly, and it's helping her overall strength and her balance. Okay, so the next slide, there's my dad. So walking again, walking in the water is actually a really easy way to start to improve strength, flexibility, and balance. So you don't need somebody like me. It's low impact, it minimizes pain, and it's more effective than actually walking on land. So it can be performed on an underwater treadmill, as with Patty, or in a shallow pool. Typically, it's performed at least in waist deep water, but the deeper you go, the more resistance there is and the harder the workout can be. Because the viscosity or the resistance of the water, it's actually, it's a higher energy cost than walking on land, so you're burning more calories. So in 30 minutes of walking in the water, you're burning 264 calories compared to walking on land, which is 135 calories. And then if you want to, again, challenge your stability, like Patty, you can go in multi-directions. In our endless pool, we have patients that do maybe a forward walk against our current 10 to 15 steps. Then they'll go straight into like sidestepping 10 to 15 steps, turn and go backwards, and then turn around to the other side, sidestep for the same thing. We'll do that maybe a couple minutes. But that really helps kind of challenges their core, balance, and it increases their coordination. So there's also, there's no fear of falling or breaking a bone, which is awesome. But and then if you want to challenge yourself a little bit more, you can add resistance with gloves or hand paddles. We have foam dumbbells here, or wrist or ankle weights. And then if you want to elevate your aquatic walking and you want to burn more calories, so this is a picture of our endless pool and our current, you can actually go into aquatic jogging. So it really provides a great balance of endurance and strengthening. So some run on an underwater treadmill, or you can run in shallow water, or if it's deeper water, use an aqua belt. In order for you to get an effective workout though, you want to make sure that you're mimicking how you run on land. So you're flexing your ankles, your knees, your hips, you're swinging your arms, and you're keeping more of an upright balance posture. It's a great time saver too because you're burning way more calories. So when you're jogging in the water, you're burning 340 calories compared to jogging on land, which is 240 calories. We have elderly patients that could never jog on land, but when they get in the water, they're actually surprised that they're able to jog in the water. It boosts their confidence. It also helps improve their stamina, it reduces their blood pressure, and it controls blood sugar. So
she's never done sit to stand before. You can sit again.
To the video. So there's going to be a video. Oh, maybe don't play it. Yeah. So I'm just going to show another video of Patty. We do this simple exercise, and it incorporates actually strengthening and flexibility training. It'll carry over when you're doing functional things. So this is called a sit to stand exercise. A lot of patients that I see, they often rely on their arms when they get up. So they're really straining their wrists or their shoulders. And I'm sure you guys have probably seen an older patient as they're sitting down, kind of like plop back on the chair. That lack of control is actually pretty dangerous because you can have back pain, or if you have osteoporosis, you can develop a compression fracture. But as Patty is going to demonstrate, it's a lot easier in the water than on land. So let's play that.
Don't forget to let them know that you
She's never done sit to stand before.
Okay.
You can sit again.
Slowly.
But now all the muscles.
Yeah, that's
So
better.
lean forward to stand up. Lean forward.
What was it called?
Do you need to like go more shallow maybe? There you go. Good one.
Sorry.
Couple more.
Okay. Let's do 3 more.
Stick your butt back. Yeah. Okay, because it's all about control. Like I don't
Okay.
want them flopping.
Okay.
And then when they're unweighting, it's straight up. Yeah.
Straight to standing. Good. So go as slow as you can on the way down. Go as slow as you can on the way down. Slowly. Yep. Stick your butt back. There you go. Good. Nice and controlled. Yay! Very good. Okay. 2 more.
Okay. I mean, usually it's
Lean forward
release or
and stand nice and tall.
yeah.
Good. Yep. And then we'll stick the butt back
I guess after all the numbing and everything went away.
and slowly come down.
And then I came
Yay!
here
Good.
Friday.
Okay, just 1 more, just like that. Lean forward. And then slowly go down.
Hey, I like this.
It's good.
I want to do one more.
Okay.
Yeah. You know why?
Why?
Even though the bus is
Okay, so no, go back to maybe Patty. So I just want to kind of go over what she was doing. Typically when she's on land, she's having to like rock back and forth to do to try to get up. So it takes her a while, or she uses her arms. But as you saw in the water, she was actually able to independently do it on her own. The buoyancy of the water is actually pushing her up, so it's assisting her movement. She's using her big muscles in the legs to start the movement, but then the water helps her, so she's able to improve her mechanics. And you saw that perfect hip hinge that she did when she was sitting down. So it was nice and gentle. She didn't plop back down. And then when she stood up, you saw that her head was up, her chest was out. She was able to do a perfect form, all without stressing or hurting her body. There was no pain at all in her knees. And typically what we will do too is to challenge a patient. We'll have them start sitting. We'll have them go a half stand, so like a squat, and then hold that for 5-10 seconds, sit back down. Or we'll go halfway up and then standing all the way, go halfway back down, and then sit all the way back down. So that really challenges their legs. Again, there's no pain or fear of losing their balance. And then there's like so many other benefits of water therapy that I wanted to go through, but I'm just gonna mention a few. So water therapy can actually accelerate healing after surgery. It can cut your rehab time because it allows patients to move through greater range of motion when they're in the water without affecting the surgical site. So it's not really popular here, but in the mainland, so like Utah State Aggies, they train a lot of their athletes after ACL surgery in the water. And a lot of times they'll be running in the water 6 weeks before they're able to on land. So that's significant. Still trying to get the word out for that. But we've had patients, I had a lady that came in after surgery to her ankle. Her surgeon agreed that she could try the water therapy, and she progressed so fast. She was also doing it in her own pool, which was awesome. but she progressed so fast that she was actually able to transition quickly and to land. And then she was able to go visit her grandchildren in the mainland. So no cast, no crutches. So it was really good. A lot of times too, we find that patients are more compliant. So there's less appointments missed because they see that it's easier to move in the water. It's less painful. They're also able to build confidence while they're in the water. So it makes that transition to land when we do land therapy. It's a lot easier when they go to land. The next benefit of aquatic therapy, that one, is heart rate. So when you're in the water, your heart is actually beating 10 to 15 beats per minute slower than on land. So when you, if you know somebody or if you have a cardiac issue, you won't stress your heart, but yet you're able to work harder because you're dealing with the viscosity, the resistance. So that's good. It also improves lung capacity. So the hydrostatic pressure, it acts as a mechanical barrier to your rib cage. So when you inhale, the chest wall expands, and when you exhale, the chest wall compresses. But the pressure of the water, it provides that constant resistance when you breathe, and you're getting actually a 60% increase in the work of breathing. So patients like COPD patients, other ones with pulmonary issues, it's you're really getting a great training effect when you're underwater, and that will carry over when you're on land too. And then it also improves bone density. So the perspective has changed in the last decade about being able to improve bone growth while you're in the water. What they say is muscle pull on bone is an excellent stimulus to bone growth. So exercising in the water, it produces that drag, and then drag produces resistance. Resistance creates that muscle pull, and so the end result is bone growth. We get a lot of patients that have osteoporosis, and a lot of times they fear of injuring themselves, or it's too painful to exercise. But in the water, they're actually able to load their bones by standing on the bottom of the pool, and they're able to do a lot more things that they could not do on land, increasing their strength. So it's a really great way to, get the benefits of exercise without increasing pain or having that risk of breaking a bone. And then just one of the best benefits of all is it's fun. That man that's in the picture, that's George. We use him a lot. Right now he's 99 years old. So I've known him for years, but he loved the water. He's right now exercising on land though, he's transitioned to land. But a lot of times I know people that they don't stick with an exercise program because it's painful or it's awkward. But so any exercise program, it has to be beneficial and enjoyable. And a lot of us, we want to lead longer, healthier lives, but exercise can be difficult a lot of times, if not impossible, especially with those with health problems. So there really isn't a magic bullet to keep us healthy and fit throughout our lives, but if anything comes close to it, it's water therapy. It's one of the healthiest things that we can do to improve your blood pressure, increase your cardiovascular endurance, lose weight. It can help depression, and it can also increase your flexibility and your strength. So
Julie, could you tell our listeners here, viewers, about some different stories while I try to find your Facebook page, because your Facebook page has a lot of videos, and I've been doing aqua therapy for what, 3 or 4 years now.
Yeah.
I had 2 shoulder surgeries in my 50s, my early 50s, and I went to 2 land-based therapists that were my friends actually, and it did help, but it wasn't for me. Being impatient, it didn't help fast enough. So luckily I had a friend of mine that went to Julie and said, hey, you gotta look at this aqua therapy. And I checked it out. I'm not a big swimmer. I really don't like getting water in my ears. I really don't like to swim. because I don't like to have to get up and breathe through my side of my mouth when I swim freestyle. But I did, and I have been for 3 years now, and so I have a mask and a snorkel, so I have to breathe out water on the side, and I have a little foam belt that keeps me up balanced. So I swim against the current for about 20 minutes, about 3 to 4 mornings a week, and it definitely has helped my shoulder, definitely helped my strength as I get older. I'm 57 now, but I think endurance-wise, I'm pretty strong, and my muscle mass is still there as I age. Where a lot of guys I play ball with are slowing down because they don't have the muscle mass. So, Julie, why don't you tell a couple stories while I try and find your Facebook page?
So we have actually we have a lot of testimonials. I have one patient that's coming now. She injured her back. She's been in chronic pain for 2 years. She, after going from everything from land-based therapy, massage, chiropractor, treatments, she came to us a couple weeks ago actually, and after her first aquatic session, she did her first one in our endless pool. She was actually almost to the point of tears because she said it was the first time she was feeling less pain, that relief, in so long. So she's excited to continue to come and progress, and then eventually we will transition her to our land program.
Yeah.
And then we if we get the Facebook video.
It's a great question, Noelani. Do you take seniors that are incontinent? Good question. I had that question too, because my mother-in-law were thinking about coming here, but
Yeah.
good question.
So so that's a problem, because we don't want any accidents in the water. Sorry. And I've tried to find other ways, like diapers, but we basically just make sure that all our patients are continent. We haven't had any accidents. Thank you. That's the hard part. Yeah. So if you guys want to look, I guess we can't find it, but if you want to go to our Facebook page or our Instagram page, we have a video of Frances, who's, I think she's 88 or something, but her daughter brought her over here. She was in a wheelchair, and really feisty patient. And we actually started her in the HydroWorks. So in the video, you'll see that her daughter carrying her into the HydroWorks because she wasn't able to walk. And then by, I think it was the 8th session, you can see her transition. She's actually able to walk slowly on the treadmill, holding the grab bars, which is awesome to get her up. So we have a question.
Insurance.
What kind of medical insurance do you take? So we take basically all medical insurances. We do Medicare, Medicaid, a lot of the Quest ones. Of course, the big ones like HMSA, UHA. And we do work comp and no fault too. I also have cash patients that come in too. And then how much is the cost? So if you go through insurance, of course, it would be your co-payment, just like if you were doing a land-based therapy session. But for patients that don't have insurance or they just want to pay out of pocket, what I do is I do a free initial evaluation, and then it's $80 a session.
And so, Julie, what are some of the standard, like somebody say if somebody had hip replacement, what's the standard? I mean, every occupation, every orthopedic surgeon has different thoughts on that. Because when I had surgery, I had 2 different surgeries. The first doctor said, take therapy the very next day, versus some doctors will tell you wait a month when the swelling goes down. What's your thoughts on when to do therapy?
Yeah, so it's pretty much all up to the surgeon, and some of them do want land-based therapy immediately after your shoulder surgery. Like I said, I've been trying to convince a lot of the physicians out here that aquatic therapy is good. We have these waterproof bandages that they're typically used a lot of times in the mainland. If you go in the HydroWorks website, there's a video that a lot of these PTs are treating patients maybe 3 days out after surgery. They're putting the waterproof bandage. There's zero report of any infection, and they're able to start moving immediately, which is key, right? Because you don't want that scar tissue developing, then you're limiting range in the hip or the shoulder. So as far as surgery, it's pretty much up to the surgeon. I don't like to step on their toes, but like I said, I'm trying to convince them that water is good.
So if anybody has connection to the UH football team, highly recommend them, because the HydroWorks pool that you saw, that you can, like, underwater treadmill, there's only, what, 3 or 4 in the United States?
So we were the first healthcare facility to get the HydroWorks Sport 300. So the Sport model is a bigger model. We got ours at the same time that the Chicago Bears and the Detroit Lions got theirs. So a little less. We have a really great water unit. So we're trying to get the word out, but it's awesome. So it's not only good for, you know, seniors and rehabbing, it's great for just athletic training, because they're able to go full blast. In that treadmill, you can go up to 10 miles an hour. We also have resistance jets that provide more resistance, so you can mimic the way that you sprint on land, and without that fear of injuring your knee or your hip or anything. So it's good. You guys got to try it.
Yeah, I highly recommend you guys try this, because, like I said, I've done land-based therapy. By the way, Julie didn't say this, but Julie does, and started out as a land-based therapist. She does, on the other side of her office, has a fully loaded side of the office that does land-based therapy. So she does both. She does hands-on therapy, which I really like, because after surgery, massage, I mean, what do you call that? Manual massage therapy breaks down all the tissues, and hopefully, you know, in most cases than not, it'll make it heal faster. But like I said, your doctor would determine, and you might want to ask your doctor, can I do therapy the very next day? Don't tell them I told you that, but you tell them you heard some people, and some doctors do recommend taking therapy the very next day. I was shocked when my doctor told me that, because I was in a lot of pain. But it does make it quicker recovery. It actually feels good when you have manual therapy, stretching your muscles, massaging your muscles. So it's very important to take a look at that. But anyway, Julie, your Facebook page, how do you find you?
Moon Physical Therapy. Just go on Facebook, and same thing with Instagram.
And then also you have a website, right?
Yep, we have a website, and we have a bunch of videos on there too for different aquatic programs, for back. We've been on Living 808 too.
KHON. And what else? And in Generations Magazine.
Yep.
Great articles. So it's really important for you to take advantage of that. So thank you everybody for signing on today.
Thank you. Tell your friends.
Yeah. Otherwise, you can find her on Facebook, Instagram, or her website. And like I said, if you have any connection to UH football or actually even high school, insurance covers it 100%. It's not including your copay. So if there's no further questions, we're going to sign off here kind of early, because Julie is very busy here at their office. But thank you so much. I appreciate your time. And look out next month, June, for our webinar next month. And you'll get a message about that. So thank you very much. Everybody have a great weekend. And I always tell you this, live well, everybody. Thank you very much. One last thing. Oh, thank you very much. I got a chat saying thank you. So appreciate your time, everybody. Aloha and live well.